I think I wanted to be a doctor.
I wanted to be an astronaut.
An actress.
A scientist.
I wanted to be a kid forever.
I had a passion for the discovery of the unknown.
Everything from biology to physics to how the world worked, how the body worked.
And there was a lab that required some dissection of small animals. I actually threw up. Medicine was probably not the best career for me.
I was working in the theater in New York, and I still wasn't happy. But while I'd been in college, I'd also taken a lot of science classes.
Science really took my interest very early on. That was through grade school, through high school. That's what really drove me. What I'm most interested in now is combining science and medicine.
Actually, I grew up in the countryside where I know I can see a lot of animals and plants and those. I always wonder how those things will change.
So I took organic chemistry as a sophomore, and it was just amazing.
The most attractive part to me is the discovery, and it's a surprise.
My mother wanted me to go to medical school, so there's that.
54 active patents, 420 in the U.S.,
834 across
60 countries,
43 therapeutics in the pipeline,
more than
1,300 faculty engage science, medicine, and research.
Over $719 million in grant and contract funding.
2016.
Over 2,000 invention disclosures.
456 licenses with income.
Over 50 startups in New Haven.
700 million in venture capital raised.
$5 billion in equity investments.
The Blavatnik Fund for Innovation at Yale
Provides $10 million in grants.
60 researchers applied.
17 finalists chosen.
Well, it's an exciting time to be a biomedical engineer. We know so much more about biology than we did even 20 years ago, that you can think about how to develop new tools based on a real quantitative understanding of biology. And then the specific projects that we've been working on, I'm personally very excited about. I think they have the opportunity to have a huge impact, and I'd like to see that impact realized.
Funding through an opportunity like this really helps us establish a critical mass that we need to overcome to take ideas, which we have lots of, to take the specific technology that we think really has a major chance and get it to a point where it can be brought to the real world. And otherwise, it kind of fizzles out.
It's this kind of award, this kind of program is really crucial. It's not just the knowledge, there's actually a lot of logistics, as you say, to move from some kind of scientific discovery to bring that to a therapy that makes a difference.
You know, anything studied in enough detail is interesting, right? But not everything has the opportunity to change people's lives.
The Blavatnik Fund has been a game changer. I'm Erica Smith, the director of the Blavatnik Fund for Innovation here at Yale. The purpose of the Blavatnik Fund is to drive discovery in academia to products in industry that can impact patients' lives.
There's funding from the National Institutes of Health and other organizations that supports a lot of the discoveries. When it actually gets to a drug and it's ready to be tested in people and profits are about to be made, companies come in. But there's this gap in between making discoveries and making dollars.
There's a certain element of risk that would allow us to do much more innovative things, which is hard to actually get support for through the typical funding mechanisms.
Well, I have a personal interest in encouraging scientific innovation, and Yale is obviously a perfect base for finding new ways to invest in the future of research and entrepreneurship. The quality of research and intellectual rigor at Yale is outstanding, and now I think at Yale we can bring it to a kind of next level, supporting some outstanding young brains, the geniuses of our generation.
Beyond the funding that these awardees will receive, they will also receive opportunities to work with our entrepreneurs in residence, our advisors and mentors, our corporate partners, as well as relationships that we've formed with contract research organizations. It takes both the science and the business, and it advances this innovation to the market.
Being in the lab and being a scientist, I know very little about commercializing anything. That's a very key issue if you want to make something be available so that patients can make use of it faster.
Yale's ability to attract a vibrant and diverse scientific community is one of the important elements. The work that has come about in my lab certainly would not have been, been accomplished if it wasn't for the rich environment.
There's this foundation in the sciences which is great. There's a medical practice which is thriving and doubling really in the last decade. So both of these arms are developing, and now I think from the administration on down and the investment of a lot of resources to build these bridges to turn scientific discoveries into medical therapies. And I think Yale's doing a great job of that. We obviously have a lot more to do, but it's a very exciting time to be part of that whole process.
So this will mean a lot to me, and because this will help us to basically bring what we have learned in the lab to the clinic, and not only the patients that are treated in hospital, but also our friends and families.
This is one of a lifetime opportunity for us, and then we all very grateful to this contribution from the foundation and Yale.
Well, if we win, I would certainly be happy, right? There's no changing that. But mostly, I would be proud of all of the graduate students and postdoctorals and undergraduates who worked on this problem over the past decade to see all of their hard work come to fruition.